We are live.
Okay, so welcome everyone. This is the daily call. It is September 22nd, and we're very happy to have Eric Feigl-Ding, who is associated with the Federation of American Scientists and with the COVID Action Group and the World Health Network. He will be talking, we'll give a few minutes. And let people come in, and then we'll be starting. Eric has been an early warner about the pandemic. If people had followed his warning, the situation would have been quite different. And he's been non-stop giving information about providing advice to people, to governments about how to respond to the pandemic. It's really a pleasure to have him here. And Eric, if you want to start talking about the current situation, or if you want to step back and give a broader picture, it's up to you.
Welcome. Thank you so much, Yanir, for the intro, and thanks everyone for having me here. I think we're at basically 2 weeks, 3 weeks, 1 month into school reopening, and obviously the concern of children has just been exploding because we've been warning that the Delta variant is much more contagious and it's much more severe. And if anything, if you look at the case fatality ratio, it's also increasing relatively much faster and higher in children than relative to adults. And of course, that's partly due to the exposure that kids have, and of course that most kids are not vaccinated. And so this creates this problem because kids are now back in school. Many governments around the world are incredibly derelict and downright abdicating of their leadership in their need to protect our future generation. And of course, the naysayers and the minimizers will always say, well, kids are low risk. Yes, kids are lower risk, but kids are more risk than ever before. And the number way to screw up an epidemic is not to look at the absolute risk. It's if you actually explode the number of people infected, that will actually sicken more people than a disease that's more severe. So let me just rephrase that. The people who, first of all, say that, kids rarely get hospitalized, kids rarely die. First of all, they're ignoring long COVID. Second of all, if you had two viruses, one is more severe but not more contagious. The other is more contagious but not more severe. In the end, which of the two forms of the virus will actually sicken more people in the hospital and kill more? Is it the less contagious, more severe, or is it the more contagious, less severe? It is always by far the more contagious, less severe that will actually sicken and maim and kill more people. And in certain ways, people who are minimizers will only just look at, it's less severe in kids on an absolute scale, but they don't realize that once you balloon the denominator, that is what actually will hurt more kids. And in the business world, I had to explain this, that I say, hey, do you want to make a 20 to 50% sales commission and then make your money that way? Or would you rather sell your widget to a couple million people, a couple billion people, and make a teeny tiny 0.5% commission on each? And once business leaders realize, any marketer knows that it's better to make more money by making tiny commissions on a huge volume. That will ultimately make more money. But in the flip side, in a pandemic, a contagious virus of a low severity illness will actually sicken more people as well. And I think once people realize that in that analogy, people now are seeing that, and we're seeing this play out. Pediatric hospitalizations are filling up. Of course, I don't need to tell you that pediatric deaths are also increasing, and hospitalizations in kids are at a record all-time high in many parts of the world, especially in the southern U.S. And of course, there are schools that are not taking enough mitigation, and of course, there are the need for pediatric vaccinations, and of course, UK also, the JCVI, up until just recently, have been against vaccinating kids under 16 years old, which is wholly irresponsible. But there's an urgency of now, and until the vaccines for children, and I'm glad the Pfizer released their studies, their press release findings, and hopefully they're submitting to FDA next week, and hopefully we'll get an FDA emergency authorization by end of next month, or at worst early November for the 1/3 dose among kids 5 to 11, and soon afterwards kids under 5. But until then, I know many parents are also asking about vaccinating via some off-label authorization in the United States, because it's fully approved by the FDA, which technically a pediatrician could theoretically give the vaccine off-label legally to a child. But up until this week, there wasn't enough data, and hence American Academy of Pediatrics hasn't pushed that. But I think in this interim month, I think we should add pressure for American Academy of Pediatrics. Say, hey, look, we have the data. The data is now released that shows it's safe, it's efficacious, just as efficacious as adults, with just 1/3 the dose. And I think we should now push for off-label use in the meantime. But obviously, that's a position of privilege, and not everyone can find a pediatrician who's willing to do that. Yeah. So let's get to reality. What can we do right now to mitigate risk? And of course, ventilation, masking, testing, quarantining. And did I mention ventilation, masking, testing, quarantining? And of course, ventilation comes with other flavors and varieties. There's ventilation, then there's air disinfection if you cannot ventilate. In environmental health, we oftentimes say the solution to pollution is dilution. So whether this is an oil spill, and whether this is wildfire smog, or whether this is coronavirus aerosol, ventilation is the dilution. But of course, not every classroom can ventilate, because ironically, in the United States, there's actually safe shooting laws, basically to prevent actually shootings, anti-shooting safety measures that prevents opening the windows. Because, in America, a bad guy with a gun can theoretically jump through a window, right? That's their argument. It's very silly, but it happens in many school districts. So in that sense, we need the disinfection. Portable HEPA filters are by far the easiest. But I warn that you need a lot of rooms are really large, and you have large number of kids. Not every school has 20, 25 kids. Some schools have 30, pushing 40 kids in one classroom. And so, some of these classrooms have very high vaulted ceilings. So in certain ways, the HEPA filters, they are good, but it depends on the size of the room. You may need 2 or 3, and then it gets a little unwieldy, and you have to put it in the middle of the room. Remember that there was a CDC outbreak, a report of this teacher who wore masks most of the time, except for the reading time. She took off her mask, and she infected her whole room. The problem with that situation actually is CDC says her room had actually ventilation and had one HEPA filter, but the HEPA filter was put on the side of the room on the wall, not between the teacher and the students. And so, these recommendations are only as good as how well we apply them and whether it's adequate for the room. You have to have enough for the room, right? And then the best way to calculate is that calculate the cubic volume. In America, we use cubic feet, and then look at the Cotter values, the clean air delivery rate of the machine, of how much air exchange it can do. Don't just rely on, this can clean your room 6 times. six air exchanges is what we're looking for at minimum, I say. But in many ways, it is not. You have to actually calculate it based on the room, because the machine that they sell assumes a certain room size. And in terms of HEPA filters, in addition to HEPA filters, there's also upper room UV, which CDC only recommends two things: UV and HEPA filters, and of course MERV 13 filters in the HVAC system. But CDC doesn't give specific guidance. ASHRAE, which is the aerosol indoor air quality guidelines organization, is the organization that sets guidelines, and their guidelines is very technical. But CDC only recommends two things: true HEPA filters, not HEPA-like, HEPA equivalent, HEPA grade. Those are all, basically fake or these knockoff or just non-HEPA products that they try to push with the HEPA name. So don't go with anything that says HEPA grade, HEPA-like, HEPA equivalent, because oftentimes those are bioionizers, which are very dangerous, or they just don't have the filtration capacity. So if you look out for one of these HEPA filters, don't rely on just, it kills 99.9%. It has to kill that, plus have the clean air delivery rate, the CADR, C-A-D-R, clean air delivery rate, enough for the room. And so the clean air delivery, like a 200 CADR or 300 CADR, is that how much per minute, but you have to, obviously account for the room size. By the way, I have no conflict with any HEPA filter companies. I just want to push it. This is the things that ASHRAE experts are pushing. Make sure you're very wary when you buy HEPA filters. Like the Honeywell is one of the most classic. Again, I have no conflict with that. And of course, for cafeterias, that's another issue. School cafeterias, kids take off masks. It's indoor dining, right? And kids yell and shout and scream. You've all been to school cafeterias or lived through it. And so it's kind of like disingenuous to say, wear your masks. Of course, please mask. And I don't need to say to this audience what importance of masking. But you can't just assume that once you take off your mask at lunchtime, it's safe. So in many ways, like my child's school district here, they basically take the kids outside whenever it's possible to have lunch. Outdoor picnic lunches, tent lunches outside is really, really critical. And I think tents and all these kind of things should, and also HEPA filters technically can be paid for by the Biden pandemic relief funding. But the issue is many schools don't allocate it. So of course, if you don't have HEPA filters, what do you do? Say your school doesn't use HEPA filters or uses enough of them. There's obviously you could ask the school, petition the school, but obviously school's already in session and that takes a long time. So this is one of those situations where you have to be creative and say, I want to just donate it. And sometimes if you're friendly with the principal and you know that they're friendly, obviously ask them, I would like to donate it to my child's classroom. But other times you can just donate it to the teacher. And of course the teacher most school districts will allow the teacher to bring whatever HEPA filters that they want to most of the time. Or the teacher, just does it, and it's their personal preference. And donate it to the school or donate it to the teacher directly. And then that obviates the need to go around the bureaucratic paperwork right now, which normally I'm absolutely for. But we have talking about kids' life on the line. Not every school district is run by competent adults, as you know. I know school district that bought like $500,000 worth of air cleaners and air scrubbing devices, only to realize it was the wrong type. It wasn't HEPA. It was one of the ionizers. So schools are only as good as what they actually have available, and of course their leadership. So this is why I think the savviest way is to buy a HEPA filter and donate it to your classroom by donating it to your teacher. I think this is something that could be a really good idea in terms of in a pinch. And of course, masks. Mask, obviously, we know it's quite a circus in Florida right now. It looks like the appeals court is going to side with is siding with DeSantis, and which this may get kicked up to the Supreme Court, which I don't know what's going to happen. But basically, your child, cloth masks, I don't think are enough. They give you some protection, like 50 to 70% protection on inhalation, but it's not enough, especially in face of Delta, which is much more contagious, as you know, and a smaller amount will get you. I can't read comments per se, so maybe the moderator can read it to me. But I think KF95, KN95 pediatric masks are really good because the fit of the mask is just as important as the filtration. I've been advocating for KN95, N95. In Europe, they call it FFP2s. FFP3s are the N95 equivalent. FFP2 is the KN95, KF94 equivalent. And but you need, for kids, you need a pediatric version that has an extra loop tightener, because the ear loops, oftentimes the mask is too big for kids, and the ear loops are too loose. So you need to find one that has a tightener. I don't have my child's here with me, but there's basically the Balluna, I think, is one brand. You can find these KF95 for kids online. Just make sure it has a loop. If your child is under 10 years old, definitely get one of the ones with the tightening loops. It's a lifesaver. So all these things are really, really important. And of course, obviously, if the school can install upper air UV, which is the other thing recommended by CDC on their website, upper air UV is not UV on your child. Okay, it's installed on near the ceilings, and it shoots a beam upwards at an angle upwards towards the ceiling to create like this zone of disinfection. And when the air circulates up and down, which within a room it happens a lot. You can basically disinfect any pathogens in the upper air zone of disinfection with upper room UV. And this actually gives you even better air exchange, because HEPA filters, depends on how big the room, but oftentimes they struggle to achieve 5 or 6 ACH, air exchange equivalents per hour. But with upper room UV, you can actually achieve like 10, 15 or more, depending on, which is really high. 10 is basically airplane level, because airplanes exchange their air every 6 minutes on average, depending on the airplane, of course. The newer ones can do 6, sometimes 5, and 6 is an exchange. 10 exchanges an hour. So this is your 10 exchanges an hour is basically how much airplanes do, which is pretty good. But it's not perfect, because there's also modeling studies that shows that the middle seat is a higher risk because you're so close to everyone. And oftentimes many classrooms are like this. So I think there's these handy personal solutions, but as an epidemiologist, I think in public health, I want to take a segue that public health, some people say, oh, we shouldn't get political. Why bring politics into it? Well, you know what? We all know politics makes a huge difference, whether it's anti-masking, anti-vaxxing, anti-lockdowning, COVID minimizing, ivermectin promotion, hydroxychloroquine promotion, vaccine. All that is highly correlated with politics, as you know. And I also want to remember that public health is policy. Policy is completely dictated almost all the time by politics. So I think in certain ways we have to engage in the policy and the politics arena, because that kind of political leadership really determines, I hate to say it, in a pandemic, really determines the policies in your area. And if you have an unfortunate governor or local school board leader, then you're at the whims of whatever the local school board votes or your governor or legislature dictates. So this is why I think engaging in these policy activism is really, really important. And I think many of you are here because you're advocates, but we're talking about kids' lives. And I think there will be there will be a time in the near future where this COVID will actually, I think, will get a little bit worse in the winter times, because winter is the worst time. I just want to put in perspective, the COVID surge recently with pediatric record hospitalizations, August normally is the all-time lowest dip in general seasonal flu and seasonal pediatric hospitalizations. It's the low, and we're seeing the high during the all-time low. And so this is why
But doesn't
I'm worried
doesn't
about the
that
winter.
mean that the seasonality is not what's driving this? It's really
Exactly. It's opposite. It's very clear. It's very clear that this is COVID driven. And some people say it's RSV driven because kids have been out of school. But come on, yes, it is RSV as well, but it's also COVID driven. And whether it's, ultimately, we're going to see a surge in the winter. That's it's inevitable. And I worry because in certain ways, the school reopening is the first time that we're actually testing the waters during Delta variant for kids, and people are now waking up. And so some places are seeing a small lull because the fall is here. It's getting a little cooler, as in oftentimes you can open the window more because it's not scorching hot outside or not frigid cold outside. Those are usually why you have surges as well, because Florida, it's super hot. Close the windows. Go inside for AC. Spread COVID when you're inside without masks. I go to these areas. I was recently in the South, and no one wears a mask there. Everyone has indoor dining, and it's without masks, and it's incredibly frustrating. And so by winter time, I think there will be a surge, and we have to really prepare for it. We have literally, I think, only a month or two of a lull. Cases, by the way, cases are not down that much. We're more at a plateau in many places. Cases are also slowly increasing in more bluer parts because it's their school reopening opened later than some of the other areas. So we're at the cusp of something in the winter time. This is why we kind of have to prepare, because winter is coming, as they say.
Eric? Yeah. So we're usually running only half an hour, and I know that your time is limited, and there were a few questions I think that would be important for you to address. And one of the questions is about this whole idea of living with a virus. Maybe you can talk about that a little bit.
Yeah, the living with the virus is a euphemism for mass infection, and I hate it. It's also, in my opinion, waving the white flag for, okay, I give up. It's endemic. Let's go endemic. So there's a lot of scientists who are saying it's going to be endemic. It doesn't have to be endemic. There is no fate but what we make, as they say. And I don't believe that we should choose the endemic pathway, because that is the politically expedient, politically convenient way of not dealing with the virus in the most aggressive form. And of course, living with the virus now comes in many forms. For example, we will no longer be quarantining people if they get positive. We will no longer be informing people of a positive case in your community. We will no longer be contact tracing, because what's the point? We don't really need to test. The virus is mild. But, all this is nonsense. First of all, kids don't even have vaccinations yet. That kids are getting sick. And again, at the beginning, what we said is, even though kids are generally milder, Delta is much more aggressive compared to before. So kids are definitely getting sicker. Pediatric hospitalizations are definitely real, and pediatric hospitals are full. ICUs are full in many places. And again, This is not a strategy. This is not a strategy. These are all mass infection approaches, euphemisms. And the lack of contact tracing, the lack of notifying close contacts, the lack of notifying parents when there's an outbreak or cases in school is just wholly dangerous. And obviously we can't change some of these policies, but we just cannot wave the white flag right now. And many governments just want to wave that white flag. And what we have to really push back on is think of the children of long COVID. Long COVID, remember, it's not just deaths or hospitalization. Long COVID, we're talking about neurological damage. In the British survey of, there was a British intelligence survey of 80,000 people, 13,000 of these people who took the IQ test. They have this intelligence census, which is amazing. They found that, of course, if you're hospitalized, you're equivalent, hospitalized and intubated, or ICU ventilated, you actually have like a 7-point IQ drop. If you're not hospitalized, but if you're hospitalized but not ventilated or ICU, you still get like a 3 to 4 point drop. But if you're not hospitalized with symptoms, you still have like a 3 to 2 point drop. And even if you have almost no symptoms or incredibly mild, you still have 1 to 2 point IQ drop. I just want to put that in perspective. I'm an epidemiologist. Remember when we all got upset that kids are drinking lead water in Flint? You know how every government in the world doesn't let kids drink lead water? The IQ effects of lead is 2 points. So if the IQ effect of lead is 2 points and no government in the world says it's okay to drink leaded water, how is it okay we can expose our kids to COVID, even mild COVID, for 2 to 3 points of IQ drop? Like, there is no universe in which we accept that. So I want to really emphasize and point this out. We took humongous action. We're taking $1 billion of action to stop lead poisoning in kids for 2 points of IQ drop. And for naysayers, they'll say, "Oh, 2 points is not a big deal." Blah blah blah. So just so you know, in terms of IQ, the difference, if you shift, obviously IQ centered around 100 points, and 100, 15 is the standard deviation, which means 68% of the people are between 85 and 115. 95% people between 70 and 130, right? And of course, there's 5% in tails. So 2.5% of the people are over the IQ of 130. But I want to just point out, a 2% IQ shift from 100 to 98 means that instead of 2.5% of your population is high IQ, almost 0% are. If you shift just 2 points, basically we entirely destroy the number of kids who have IQs over 30. That is the argument. Like, when people asked about back in the lead poisoning days, oh, what's the big deal with 2 points of IQ? That is the big deal. You're basically destroying our future children's hope and dreams for so many kids, and that's just, of course, it's just the tail of it.
Eric.
Yeah.
We're getting to the end of
okay. Sorry, I got a little passionate.
And I know that there's a lot to say, right? We've been facing this for a long time. I think that the key thing that somehow is not being recognized is that what you're talking about now is the brain damage, which is very, very severe. And it's not just that, right? There's many aspects of it. So this is one measure of the harm. But there's also other harm. There's organ damage. We're now getting information about diabetes happening.
Yeah, kidney damage.
Information about, we've already had damage to the lungs, to the heart, to the brain, but there's damage to other organs. And the increasing information about the extensiveness of that kind of harm, the long-term disabling harm, is on top of the fact that kids are in hospitals, and there are a lot of deaths among children in hospitals that is totally counter to, the whole narrative about the idea that kids are not being severely affected. They are. And again, that's one part of it, and then there's all of the infections of the parents and the grandparents and so on. So there's clear that there is an attempt to minimize the harm that doesn't make any sense in terms of the values that have been the values of the society for a long time. And it doesn't take a lot to see that, right? If a plane crashed with 100 people, it's a huge disaster. You know, the comparison between the people that have died in COVID versus war or versus terrorist attacks or murders or whatever, everything that we care about in terms of protecting life is somehow been dismissed in the context of the pandemic without reason when we have the opportunity to prevent it. And that's really the crux of it.
Yeah. And I think all of these like sequelae, these long-term impacts are completely ignored. And the severity of COVID is going to stay with us for many, many, decades. And we're talking about entire generation. I think the next thing will show up in the 5 years will be, I'm also a health economist, will be that the healthcare costs are soaring. We know longevity is already dropping, life expectancy, but healthcare costs are going to absolutely balloon. And that cost will be also shifted to our next generation as well, because we know that these costs are just completely unbearable in many countries. In the U.S., medical bankruptcies, I don't need to tell people who live in America how bad medical bankruptcies still are, even after all the reforms we've had. And I know that UK, there's talk of privatization. Don't do it, UK. It's horrible. You don't want to end up like us in the US. But the healthcare costs, in addition to long-term generational damage, is just astronomical. And I know we don't have time to get into it, but please, use all these emotional ways. Like when you talk to a school board out there, and I want you all to join one of these, parents, save COVID, save kids from COVID advocacy groups, and the World Health Network global website, worldhealthnetwork.global website will have lots of these, and join our mailing list. But when you talk to people who are on the fence, oh, but kids need to be in school, kids do need to be in school. Kids also need to live, and kids also need to not have their brain damaged. I think in certain ways they're like, kids need to learn, their brain needs to develop, but argue in a polite way. Like, do you think lead poisoning is okay? Like, go from a position in which they oftentimes will agree with you that lead poisoning is not okay for kids, right? Almost everyone agrees with that. Then remind them that COVID, the IQ damage from COVID, even if you have no symptoms, even if you have no hospitalizations, just mild symptoms, is equivalent to lead poisoning. And if they accept that other premise, that lead poisoning for children, bad, horrible, definitely don't want, then tell them that you get that initial acceptance, then so the data shows that the COVID damage on IQ is similar, then basically you've already bought them into agreement. And as long as you show them this data, you can get them onto your side about the long-term damage to kids, where, of course, besides
Eric,
kids being orphaned. Yeah.
Eric, have you tweeted about that? The lead poisoning?
Yes, I have. Yes. So the study was in all people. It wasn't just exclusively in children, but you should assume that it happens in kids too. So I think just search my name, Twitter, and then IQ points, or IQ drop or something. IQ drop. You'll find it. I have a long thread about it.
What would you suggest?
This is serious.
What would you suggest when we have a health authority, like I'm a teacher in Sweden, where, I'm the only person in a school of 1,000 people wearing a mask. I know I'm not being protected by others at all. And our whole health authority is saying no safety, no increased ventilation, no HEPA filters, no screening, no masks in school. So we're basically inflicting 2 million Swedish kids, which is as many as we have, to this virus. What can we do? Any suggestions?
What can you? Yeah, this is where, obviously, what can you do for yourself and your family is mask ventilate, HEPA filters. But obviously, for your local schools, can try to convince the principal to do it, or the school board to do it, as we have in the U.S. But on a national scale, I don't have an answer. Anders Tegnell, we know, is definitely not a zero COVID kind of guy. He is the exact opposite. He's one of the, the hailed heroes of the other side. So I don't have an exact answer, but this is where public health equals policy equals politics.
Yeah.
Right?
So
the greatest pathway is through policy and politics.
I think this is important, what we've been saying here throughout. And I think that, one of the ways forward, and Sweden is going to be a hard process, obviously, to fix things. But there are a lot of countries now where the parents are organizing, and there are groups, in the US, there's really been a huge growth in groups. They're in New York, they're in Washington, they're in Tennessee, they're in California and Arizona and Michigan and Rhode Island and Massachusetts, all over the country. Groups are forming in order to promote safety in schools through masks and air filtering and testing and quarantining and ventilation and distancing and so on. So there's a lot of work now being done to improve safety in schools, and also, of course, to allow parents and families to have the choice of remote learning. And so having all of those choices is important. And then beyond that, the opportunity to really shift the conversation so that we recognize that living with this virus is not the way we want to go. And even though it's hard for some people to think about the alternative, it really is the way forward. And if you want to be referred to parents groups, you can sign up for the World Health Network. We're happy to get you involved. Eric, I know you have to go. I want to let you wrap up. Do you want to say a couple more words, and then we should wrap it up?
Yeah, my final words, of course, is, all these policies, take time, but it takes movement building. And I think movement building around each of these issues is really key. But also, when you talk to other parents, or school boards or school leaders, don't inundate them with facts like I do. Just remember, people remember not what you say, but how you make them feel, right? And so this is where the strategy with the lead poisoning analogy is really key, because people are very emotional about protecting their kids from leaded water. Think Flint, Michigan. Think anywhere there's lead poisoning. And get them to buy, first of all, don't you care about lead poisoning? Do you think lead poisoning is bad for kids? Have them buy into that emotionally and get them to evoke that feeling. And once they have that feeling, then put them out there that, look, here's the data on kids and here's the data on long COVID and IQ, which is irrefutable. And then they kind of are already accepted. Yes, they're in that emotional anger about this. And regardless what they feel about COVID or not, once you get them emotionally bought in that kids, lead poisoning and damage and it's dangerous for their IQ and long-term health, and then they accept that COVID does the same, then you would have started a conversation, and they'll remember their emotions about this, rather than just you spewing facts about ventilation, masking, and all that kind of things. Okay. So, anyways, I think that's the best way to convey when you are publicly advocating on these issues. So,
thank you.
Hope this is helpful.
That's hugely helpful. Thank you for your insights and for joining us today. And we hope to have you back again soon. And everyone, thank you for coming. Let's turn off the